Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hello, happy Q&A day today. We also like to share wins with our members. So we like to celebrate their success, those who graduated from the program or are just doing really well in the program. And this week we are celebrating. So started the program at 30 out of 132, and in 3 months is down to 13. And is able to get back to their normal activities, which they had shared that they absolutely love. And then started at 83, and in 4 months is down to 9. So congratulations to both of those members.
Good work.
And we can start with our first question of
Hello.
Hi.
Hi. Congratulations to those two people. I finished the program, but I'm still kind of doing it. So I just want to know, how do I go about now doing all the rehab, doing all the exercises, because my memory is so bad and I want to get them all in one place at the same time. And so what do people do? So they've done the program and they're up to rehab, and then they just want to get all the exercises in one spot. How do they do that? Do they record it and put it in or is it, can you research it and all the exercises come up? How do I just don't know how people do it. So all the eye exercises, because my eyes are still, been my biggest problem is my eyes. So I just want to get all the rehab exercises in one spot, you know what I mean?
Well, there's a few options. So one, if people get to the end of the program and they still have symptoms, we always tell them go back to the start and then start over again, because every time you do it, there's going to be pieces that you're coming at it from a fresh sense, right? The first time you go through it, your symptoms are probably a lot higher than they are now. And so going back through it again is able to shave even more off. We've had people go through 2 or 3 times, and then that's how they hit full recovery. So don't be afraid to go back to the start. Once you're done the program, it doesn't mean you're done. It just means you have to go back to the start and kind of do it all over again. And that will unlock some things. When you get to the rehab, for example, on the vestibular side and the visual side, right? That's in that one section. You don't have to do every single exercise, right? The whole point is to run that assessment. So the first video is the assessment, and you basically follow along with that video as you do the assessment, and that'll tell you the areas that you need to work on. And then from that, the next section has the rehab for each of those areas. So basically, after you do that assessment, there's going to be 2, maybe 3 things that you actually have to do. You don't have to do everything. But then from those videos, and there's also handout sheets below those videos for those rehab exercises. You basically would watch those videos, write down those exercises, and then incorporate those into kind of your daily routine. right? So it's not like you have to like do everything that's there, because that's not the way it works. You have to identify where the problems are, then go to those specific exercises, right? So that's one way of doing it. Another way of doing it would be if you found, a concussion rehab clinic that would do a full assessment on you and provide you with specific rehab for those particular issues, right? So you can go about it either way. But I would recommend that for anybody, if you get to the end of the program and you're still like, oh, I still have some issues, go back to the start and just go through it again, right? And then in terms of your question, you have those two options. Figure out what the rehab is you need to do. Now, remember, a lot of visual problems, you're saying my eyes have been the worst, right? We know that you had a significant neck injury too, right?
Yeah.
Most visual well, I wouldn't say most, but a lot of visual problems are actually just related to neck dysfunction. So rather than even focusing on the rehab, it's like, how do you fix your neck? Because the vision might fall into place.
Sorry. When I was just back in Australia like 3 weeks ago, a friend of mine, she is a physio, and she got her hands on my neck, and she said in my joints, like where the C5 and everything, it was just still like, so it felt like it was over 2 years ago, but it's just still so like, oh my God, just so tender.
Yeah, I mean, it generally won't fix itself, right? So unless anyone's fixed it, it's still going to be like that. And so
I don't think anyone fixed it.
right. And so you may just need some manual work on that, as you also maybe incorporate the exercises, because it's good to kind of do both. A lot of people make the mistake where they have a vision problem, like you're saying, and then they end up in vision therapy for months and months and months, spending, $5, $6, $10,000 to go through that, only to realize like it didn't really help, because the reason they had vision problems was a neck issue. So it's always good, if you are going to do vision rehab exercises of any kind, that you're also incorporating neck work at the same time, so that they complement each other and they actually work together. So I would always recommend, because I know you had a significant neck injury, right? I think you were the surfing accident or something where you
that hangman's fracture.
You had a fracture, right? So like obviously things are going to be really jacked up. Like even from a nervous system perspective, like your nervous system is going to be on edge because you had a significant injury. There's a lot of neural input in your neck, and there's a lot of overlap with like autonomic function with your neck. And so a significant neck injury like that is going to take a lot of that foundational stuff. So, I would recommend in your case that you go back to the start and kind of work through all those other components as well. But adding in rehab now wouldn't be a bad idea either. So you could kind of go about it both ways. You could go to the rehab section, go to the VOMS thing that we have there, go through those exercises, figure out which ones are the big triggers for you, which ones flare your symptoms the most, then find the corresponding exercises that go with those, pick 2 or 3, and that's where you start, right? So you don't have to do everything, you just have to do 2 or 3. And you're working on those, but then you're also knowing that the neck is involved, so find a really good, manual therapist to start, treating the neck to get that function working. And then in the meantime, you're also going back through all the other sections and continually addressing those, right? Because you want to get yourself away from the edge of the cliff too. So you want to build resilience in those systems. So repeating it is a good idea.
Thank you so much.
Does that answer it?
Back to the drawing board. Yep.
Not necessarily back to the drawing board, right? You're still like you've probably progressed quite a bit since you first joined.
No, I'm amazing. I'm actually like so much better. It's just the eye, because I've always driven the car like in Bali ever since I did it. Even when I first did it, I was driving myself like at least 3 hours a day. But it's just like obviously it's my neck, but it just feels like my eyes. And then like if I move my head a lot, or getting out of the car, I just feel like I'm like off my head on another planet. But right. I mean, I still drive, but I'm like, I don't know if I should be driving.
Yeah. But, I mean, it sounds like there's definitely some neck components. That's usually like the description where it's like, okay, there's a lot of movement, trouble with like motion sensitivity and crowded environments and driving in cars. A lot of that is neck related. It can be vision related too, but that's why you would do kind of both of those aspects.
Thank you.
You're welcome. Okay, next up is...
Yes, hi everyone. So I have a question, which you also partially already answered, but maybe I'd like to describe my situation a little bit. So I'm suffering from the PCS now for 1.5 years. And what's happening to me is my situation always increases and then decreases again. So it gets better and then gets worse, gets better, gets worse. So that's what's happening for me actually right from the beginning. And I also get kind of new symptoms. And that's also what happened to me like the last weeks. So I started vision therapy in February. And in the beginning, it improved a lot. And then what happened to me is that I was suffering like brain fog for 2 weeks nonstop. And right now I have the feeling that this is especially triggered by working on my computer or on the cell phone. So yeah, I'm not really sure what to do with that because the eye issue got worse actually. So especially when I'm on laptop, I feel sick. My eyes hurt also a little bit. I get headaches and so on. So, and it wasn't like that before. So do you have any thoughts about this or anything I could do about that? So my therapist told me I should start again with VOR exercises. And I also do some tonics. Yeah, but I'm also quite afraid of it because like my whole work depends on the computer. So when I'm not able to work on a computer, I cannot work at all.
Mhm.
So quite afraid about that.
What, where are you at in the program?
I finished it actually, so I already started in August. But I actually think I need to finish the neck topic. I'm not quite sure if I finished it or not. I've started it for sure, and I also did some manual therapy and things like that. But when I did this, it actually felt worse. At least the neck, not the eyes, but the neck felt worse afterwards. So I stopped with that.
How many treatments did you do with manual therapy?
So I went to physiotherapy, and then I did how's it called? I also went to a chiropractica, and I went there just once because after that it was worse actually.
So this is the mistake that a lot of people make,
Mm-hmm.
is that they go for treatment and it flares them up and then they get scared and they never go back.
Mm-hmm.
Now, the issue is that when you do manual therapy, it often flares people up, right? I have that conversation with every patient, right? You might feel like absolute crap after I do this, or you might feel really good. So it can kind of go either way. Either way, it tells us that something's wrong with your neck and that we're just waking things up or moving things around, right? Like if I treat your neck and nothing happens, now I'm starting to think maybe neck isn't involved. But if I treat your neck and your symptoms go away, okay, your neck is involved. But also if I treat your neck and things get much worse, I know your neck is involved as well. So the antidote for that is to keep going. Because the first time I treat you, you might get flared up. The second time I treat you, you might get flared up, but less so. Third time I treat you, you might not get flared up at all. And so it's like you kind of have to go through that cycle, because the fact that you got flared up with treatment tells me that your neck is involved for sure. And it's also involved in a lot of eye things. Now, the trigger for doing vision therapy and having your symptoms get worse is because every time your eyes move, your neck engages. And your neck tells you where you are in space, or a lot about where you are in space. And so if you are doing vision rehab and you're doing eye exercises and you have neck dysfunction, that's going to result in your neck starting to cause increased symptoms like eye pressure, eye pain, headaches, and that type of stuff. But then because your neck is getting tighter, because of the dysfunction in your neck and you're doing eye exercises, now the neck feeds back to the eyes and your eyes actually get worse. This is why I say never do vision therapy in isolation. Always make sure you're doing neck work at the same time.
Yeah, that's why I started it. But then I was really afraid, as you already said, because after the treatment, like my neck cracked always. So I was quite afraid that it actually hurt myself more than it helped. So, and it still cracks. And it wasn't like that before the treatment.
Yeah, cracking is nothing. Cracking doesn't mean anything. Cracking doesn't mean anything, right? Now, if you have, for example, like if it pops once and lets go and it doesn't pop again, like can you repeatedly crack it if you were to move it?
Yeah, but it's very silent. I can just feel it inside myself. It's not like big loud cracks that other people hear. Do you know what I mean? Like,
Yeah, no, but is it like if you were to move your neck back and forth, does it crack every time you move it?
yeah, when I move it to the side, yes, it actually always does it.
Yeah. So there's a difference, right? If I crack my knuckles, right? Can you hear that?
Yes.
Right? Once they've popped, they won't pop again. See how they don't pop anymore?
Yeah.
Right? So that's a joint. So when you have air trapped in a joint and it cracks or pops, you can't do it again. It takes time for that to build up again, and then you can do it again. But if you have repeated popping, like every time you do it, you feel this cracking and crunching, all that is tight muscles that are snapping over top of bones. So if you have really tight muscles in your neck and you move, it's going to be, let's say it's on this side of the bone, and then you move and it pops to this side of the bone, and then it pops to this side of the bone. And to you, it feels like cracking, but all it is like a muscle popping over a tendon, right? Like I have like a tight hip flexor on my right side. And when I do like an exercise like dead bugs or something, it'll pop every time. And all that is, that's nothing to worry about. All it means is that there's a muscle that's really tight, and when I move, it snaps over top of a bone and back and forth. So every time it sounds like a pop, but it's not actually a pop, right? It's not a cracking joint or anything like that. Doesn't mean that anything is worse or anything. It just is an indication that there's a tight muscle in there that's snapping. So you do some soft tissue on that, you release the muscle, and the popping goes away. But the popping is nothing to worry about. Like literally, you should have no concern over that whatsoever. It doesn't mean anything. So don't be afraid of that. So it seems like the direction that you should probably be heading is like the first person, go back and go through the program again. Because if you've gotten to the end and there's still issues, like go back and make sure you keep working on those other systems. Because like inflammation, for example, will cause neck dysfunction, autonomic issues, stress, tension. If you have worry about your symptoms, that's going to increase tension. And that tension is going to increase symptoms, which is then going to increase worry, which is then going to increase symptoms. And the cycle will continue. And that's how people get worse and worse and worse over time. So you want to make sure that you're addressing that you're keeping things calm, that you're balancing your autonomics, that you're doing exercise, that you're not letting these things really worry you. But then on the other side, I think probably neck is the component that to me stands out, but I'm a chiro, and neck is all I preach pretty much.
Yeah. So maybe one last question to that. So if you say I should continue with the treatment, so should I focus on chiropractor or physiotherapy, or should I make exercises by my own?
No, it's not. Exercises are generally not really helpful for this.
Okay.
So it's manual therapy. Whether that's a chiro or a physio, I don't think matters as much as what the treatment is. So have you seen the manual therapy videos I did? So if you go to the resources,
Yes.
I did manual therapy part 1 and part 2. Have you watched those?
I think that's still missing. That's the part that's still missing.
So if you go into it's not in the course, it's in the resources.
Okay. No, then I haven't seen it. Yeah.
Okay, go to the resources, look up like weekly seminars, go to my section, and I have a 2-part series on manual therapy. And I talk about kind of what you should be looking for manual therapy. And that will answer a lot of your questions, because if you're seeing a chiropractor, but all they're doing is adjustments, crack, 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 that's not what you want.
Okay.
You want soft tissue work, maybe some acupuncture, maybe some adjustments, and then maybe some exercises. So I talk about how to phase that in. So once you see that, you'll kind of understand, okay, this is what I'm looking for.
Okay, thank you. So he did also dry needling with me. Is this something which is good? What you recommend? Okay, perfect.
Yep.
Thank you very much. That was really helpful.
You're welcome.
Yeah, I was going to add in there too around building that safety with your provider. So if we become afraid after an adjustment, it makes sense to be hesitant after. So maybe openly communicating that with your provider. Say, hey, this really freaked me out. I feel scared now. Like, can you help me to like gradually build back up to what we were doing? I just need to build that trust, right? So often a lot of this is building trust, because if you go in and you feel unsafe and you're worried about an injury, you're going to be holding so much tension in your neck and in your body that it's unlikely the treatment will be helpful or effective. So it's sort of this two parts, following what Dr. Cam has said, and then also remembering to have that conversation with whatever provider it is that you're seeing, so that you can start to build that trust and feel safe with them. Because if you feel safe, then you're going to feel more relaxed, you're not going to be holding tension, and your treatment's more likely to be effective.
Mm-hmm.
Thank you a lot, Melinda.
I feel like the theme today is going back and just redoing some of the things that we've gone over the first time. I'll tell, because there's no hands up right now, I'll share a quick case with a patient that I saw yesterday that was a member of the Concussion Fix. So this person has chronic head tension. There was a lot of concurrent anxiety present, and they went through the course last year, but they were in a state of heightened anxiety. So they kind of went through, checked all the boxes, but didn't really have a chance to implement everything. And so from July of last year, when I saw them previously, until December, they said they were just in a heightened spiral. All their symptoms were worse. So it's like a tension, pressing, and that was affecting kind of like clarity of vision. And I mentioned the anxiety. So as of January of this past year, 2025, this person decided, I'm going to full commit back to the things I learned in the program, specifically going all in on the diet. Now, I'll explain why that's important in a second. But basically what I'll tell you is that they noticed that their energy was better. They noticed that there were some improvements, but their symptoms didn't totally go away. But what it represented was that they were now committing to doing the things that they glossed over the first time. So sometimes it's okay to go back to previous lessons, things that we've identified that we didn't really actually fully implement. And it's something I see, and we've clearly just talked about in the last two questions, it's something we see very often. The first time through the course, it's, there's a lot of information. I see from the Q&A chat that people are interested in the new 2.0 course that's coming out very shortly. We just finished recording it all, and we're excited to launch it. We'll talk about it in just a second, but I'll just tell you it's way better than the current course, and we think the current course obviously works very, very well. But I think that it's good as a self-reflection activity, is looking back on, is there something that I might have skipped through, overlooked? And sometimes we're not ready to do the things that we initially thought that, it's too difficult to do. So this person, just to finish the case, this person finally went back to, and now is working with a mental health professional. So this is a big shout out to Melinda and her work that she's doing. And anxiety was the biggest issue. And I explained, you always feel like you have cognitive issues, you have memory issues, you have brain fog. I said, primarily post-concussion, that is a lot to do with depression, anxiety, not because your brain is broken or injured or it's somehow swollen somewhere. It's because our mental state influences our ability for neural networks to properly function.
Mm-hmm.
So, this is just top of mind. I just wanted to share it. And he is doing better. And then it's interesting. We've talked about things like laser. We've talked about things like hyperbaric. We've talked about, kind of these like more frilly type of things. And go back and look at the resources. Dr. Cam's done a lot of work with those. But just in the last week, I've had a couple pieces of feedback where one person found a lot of benefit with acupuncture. Another person found a lot of benefit with laser. This person I just mentioned, this case, just started doing some hyperbaric and felt like that was really helpful. Now, it's still early days, but at that point, when the dust settles, now some of these other treatments that you're doing can actually be more effective. And on a basic level, when you look at the mindset, when you look at the diet, when you look at some of the basic movement, now your manual provider is going to be more successful with treating you, because now the level of inflammation and your ability to respond and hold those adjustments and hold that therapy is going to be exponentially better. So if you're still having symptoms, I think this is a great lesson for everyone.
Yeah, for sure. The other thing too, I just want to talk about the safety thing. This is just a comment of like practitioners. I find that what practitioners don't do enough of is like set the stage for those types of things and have those conversations with their patient, because I'll have patients that all flare up, but they'll come back because I've already told them that this is a possibility, right? Because it's like, look, here's the risk, right? We run the risk of actually like aggravating things. Now it's just temporary. It just is a sign that your neck is involved. And I think by having those conversations as clinicians, it helps patients when that happens, that they don't freak out. And it just allows them to be like, okay, this is a normal process. Sometimes, you have to get a little bit worse before you can get better. So I think that's an issue that clinicians need to address.
And even patients, as you're going in and working with providers, at the end of every single one of my visits, I say, okay, so here's my suggestions for you. Here's my protocol. This is what I'm expecting to happen in the next 2 months or however long we're going to see each other. A lot of clinicians, as you said, Cam, don't really have set those expectations. And a lot of times those expectations might be adverse effects or things to look out for. And when you set those expectations, if they do happen, patients are not surprised and thrown off and never come back and see you. But it also kind of puts you in a mindset of like, this is the direction I'm going. So if your doctor, your clinician, your physio is not saying or talking about these things, at the end of the visit, ask them, okay, not just like, is there anything that could hurt me? That's the obvious one. Every clinician that's regulated should be able to give you that. But it's about, okay, so how long, what should I be seeing here in the next couple of days, the next couple of weeks? Should I see improvements in sleep? They're like, oh, no, I'm actually addressing this. And this way your expectations are going to be in line with the treatment, rather than like, I'm going in saying, I want my cognition to be better, or I want my brain to be fixed. And they're like, no, I'm actually working on sleep first. And yes, that those might have improvements, but when you have proper expectations, just like with anything in life, we're going to not be disappointed and we're going to be in line with what we're actually trying to achieve.
Yeah, I think it can be a scary thing to speak up with your health provider, but I always really have those conversations as well, because as much as you want your health provider to take good care of you, that shouldn't stop you from speaking up to say, hey, this is where I'm at today, and this is how scared I am about what could happen. I think it's a misconception, because the more you speak up and communicate to your provider, the more they're able to tailor their skills to fit your needs. So even if the provider doesn't share that with you up front, maybe there's some reasons for that. Maybe if you're really anxious, they decide not to disclose what could go wrong because they don't want to spook you and have you, take off and not try that therapy. But the flip side is that they probably welcome you to express what your needs are, because then they can kind of tailor their expertise to meet you where you're at. So it can be a really hard conversation to have with your health provider, and it can, give some people some anxiety. I mean, a lot of people go in and just say, hey, I'm desperate. I really want your help. And they want to do whatever their health provider is telling them to do. So that can actually stop people from speaking up for what their needs are. But the irony, or, the paradox really is that if you speak up, you're probably going to get better and more aligned care. So I always encourage that as well, right? Speak up for your needs, share, what's on your mind. If you're really anxious, share that with your provider, because they're going to be able to, ease in, right? Maybe they do things a little bit slower than they normally would, or they'll be able to modify certain things so that you can build trust. And, from my world, building trust and feeling safe with someone who's going to be touching your neck after a neck injury is just such an important piece of this whole puzzle.
I was going to say one more thing just about the trust factor. There was a study that was done like years and years ago. I remember learning about it in chiro school. But just, it's like the confidence level of the practitioner and how that matters. So this study was done, it was using medications. So there was 2 groups, and they all had like some pain condition or something. I can't remember exactly what it was, but both groups got the same thing. Both groups got a pain medication. It was the same one. And the only difference is that the doctor would go back, whoever like the doctor was in the study would go back into a room to get the medication, and the person giving the doctor the medication to give to the patient, they basically were told either this pill is going to make their pain worse or this pill is going to make their pain better. So the doctor would come back in with that medication and just hand it to the patient and not say anything. There was no verbal exchange between the patient and the doctor. But then they analyzed what the results were. And the doctor, like if the patient got the pills that the doctor was told that these pills are not going to be effective, or they're going to, this is like the placebo, this is going to make them worse, the doctor would just hand those pills and the patient would actually get worse. Yeah. Because something even within that nonverbal communication between the confidence level of the doctor handing a patient a pill that they thought would potentially make that patient worse, the patient actually would get worse with that. But they were all getting the same medication. Whereas the patient's getting the one that the doctor was told that this is going to make their pain better, the patient would get better. So it's a lot about the delivery and like the trust in the doctor and even their nonverbal kind of body, language and stuff like that. So I don't know, I always found that study like super interesting, like no verbal communication whatsoever. And it like had this tremendous effect on each of the groups, depending on what the doctor thought was going to happen. Anyway.
There's just one chat question that wasn't answered. You guys have gotten all the other ones. When you were talking about, popping joints, things like that, one member wrote in, is overcracking my joints a way to increase arthritis in the future? A dispute between my wife and I that we often have.
Actually, it's kind of the opposite, which is where I don't think we fully have like a lot of evidence on it. But the theory was like, oh, if you crack your knuckles, that'll increase your risk for arthritis, right? And then so it was like, well, is that the same for the spine? If you actually think about what happens when a joint pops, the idea is that in order to keep a joint healthy, it needs movement, right? Like you think about all the other tissues of our body, we have blood flow. So our heart pumps oxygen to our tissues and nutrients to our tissues that they can use. And then it brings back all the waste products. And then we expel those waste products, right? Either through, urination, defecation, or even just breathing out. We breathe out our CO2 and other gases. Now, joints don't have blood flow in them, right? We're not pumping blood into our knee. We're not pumping blood into our finger, into the joints in our fingers. Instead, joints have tissue called synovial tissue. And that synovial tissue makes synovial fluid. And the way that it keeps the joints healthy is by movement and circulation. So if you've ever had this where, like, let's say you're sitting for a while and you get up and your knees are kind of stiff, you're kind of like, oh, I'm stiff because you've just been sitting for too long and you got to kind of move around to feel a little bit better. That's because when you don't have movement, that fluid just sits there. And it's almost like you're cutting off the circulation to that joint. Right? We need movement to lubricate our joint, to pump in the healthy stuff and pull out the waste products. So when a joint gets stuck and it's not moving properly, what you get is the joint doesn't move, so you don't get good circulation. But then you get this buildup of gases and inflammatory waste products that stay in the joint. And what that starts to do is it actually starts to break down the joint because it doesn't have movement. Right? But by adjusting it, what you're doing is you're actually restoring movement in that joint. Right? So you're actually bringing new fluid in, pumping old fluid out, and you're restoring movement so that it can move properly. But if you let that joint sit there, it will generally become more likely or more prone to developing arthritis over time because the waste products start to break down the joint and actually make things worse over time. Also, arthritis tends to come from instability. So if a joint, like as we age, we lose water in our discs. So if you think about two vertebrae sitting on each other, we have a disc in between. When we're young, those discs are taut, like they're very tight because there's a lot of fluid in those discs. But as we age, we actually lose the fluid content. And so those vertebrae get closer together. And what you get is kind of a bubbling of that disc, right? People say I have disc bulges and whatnot because you're losing that water. So when you lose that water, now the vertebrae can move a lot more. And so if there's too much play in the joint, what happens is your body will react by creating what's called osteophytes, which are little bony outgrowths. And that's your body's attempt to try and stabilize something that's becoming unstable. So there's kind of a trade-off. If you would do too many adjustments, you could potentially just be creating more mobility. And if you have too much mobility, then your body will react by developing arthritic changes to try and stabilize. But on the flip side, if you have a joint that's stuck and you don't adjust it, that is breaking down the joint surface and actually leading to potentially unhealthy joints. So it can go either way, right? If you leave it and don't crack a joint or don't adjust the joint that needs to be cracked, you're potentially increasing your arthritis risk. But if you do it too much, you're also potentially inducing hypermobility, which then also can create, right? So it's all kind of about the balance. You don't want to do it like day in, day out. But you also, if something needs restored movement, you want to make sure that you are able to restore that movement.
Very thorough answer. Thank you.
Yes. As I crack my own neck over here.
I know. I crack my own
demo.
neck and knuckles all the time. And actually, my husband and I have the dispute also because he used to play baseball, and as a catcher, his hands hurt and that from catching for so many years. And so we have the dispute at home too. So I'm gonna share this with him and be like, see?
Yeah. And I think this is different than cracking someone's neck, which is an adjustment, right? I just want to make sure people are clear on that. That's a chiropractic maneuver. There was a person in the chat asking, when should I allow somebody to crack my neck? And Dr. Marshall said that's a personal decision. That's also a conversation that you have with your provider. A lot of people are very hesitant about getting their neck adjusted. Cam deals with this all the time. My brother's a chiropractor, so I know a lot about this as well. A lot of times people have had one poor experience with it in the past. There's two types of chiros. There's the I crack only necks, and then there's like Cam and kind of the newer school chiros where I'm doing like manual care. I'm spending a lot of time with patients. A lot of people are used to the old type of chiro where it's like, every 10 minutes they'd go and adjust, and then you're out of there in like 10 minutes. So there's a difference in treatment.
Great. We do have one person who put up their hand, so maybe we can answer their question, and then any time left after, we can kind of go over the new program.
Thank you, guys. Thanks for taking my question. So yeah, right now I'm in a bit of I think basically after the concussion, I'm just discovering that I had more than a couple of things going on. I addressed the neck and it's been feeling much better. But recently, some blood tests showed that I was deficient in testosterone. And that kind of opened up, like, I never had considered that my fatigue and other like headaches or things like that were related to that. But as I was losing more energy to do things during the day, like the mornings were really tough, like super, ever since the accident, basically the first 2 hours of the day, I had a headache and had very little energy. And as the day progressed and I was kind of starting to feel better, unfortunately, for years, that didn't include into the hormonal part of things. But now with that test, I started testosterone replacement therapy. I'm into my second month. I haven't really noticed a whole lot of difference in my energy levels, and I was wondering if that's common. Like, what should I be expecting? And the reason I'm asking, I've asked the providers, but it's kind of, I had to go through a naturopath to get a person in basically the people that give you the medicine to send a letter to my general practitioner to approve the treatment. So it was kind of a bit of a circle there too. Yeah. Because my general practitioner wasn't too sure to start the replacement therapy treatment. So yeah, I was wondering, what should I be expecting? And yeah.
Can I ask how old you are?
I'm 47.
47, okay. So the reason I ask that is that over time, testosterone goes down decade over decade in men. Generally speaking, if the low testosterone is responsible for the symptoms you're experiencing, any hormone replacement therapy, usually within a month or two, somewhere around the 6-week mark is usually what I tell patients, people should start noticing some sort of clinical improvement. Now, you are looking at this from a brain and PCS perspective. Let me ask you this question. Are you noticing any other improvements in other areas that testosterone is responsible for? Like, for example, sexual function, libido, things like that, which is one of the most obvious things that you can kind of assess and measure from a kind of qualitative perspective. Any changes in those areas?
Yeah, I've a little bit, like not a lot, a little bit more.
Okay.
And sorry, and I forgot to mention one thing. Like, so also some of the results were normal to low FSH, and basically we were trying to figure out if the problem was coming from the gland itself,
Right.
or if it was signaling from the pituitary.
Right. And what happened? Did they figure that one out?
So yeah, the result, like I just met with a neurologist in Calgary, and they think most possibly is hypopituitarism. The levels are not like too low, but they're definitely not high, which would indicate that the problem would be with the testicles or.
Right. Right. And which is hypopituitarism is the thing that occurs after a concussion. It can occur up to or over a year after a concussion. So definitely it's a slower onset. So here's the thing with testosterone, the main symptoms of low testosterone for males is a decrease in sexual function and desire. So that's the libido aspect. That's the obvious one. That also, by the way, applies to women as well. Testosterone and estrogen drive their libido. Secondly, testosterone impacts mood in men primarily. And energy, I would say, is one kind of benefit you might get, but it's not the most common one, to be honest. So if your energy is low, if that's one of the main things you're looking at, or just general kind of cognitive function, have you had your growth hormone assessed? Because if you have hypopituitarism, like low FSH, then you have to obviously look at other hormones that are produced by the pituitary. So TSH, thyroid. Then you have to look at your adrenal system. I'm hoping that your naturopathic doctor looked at that, because that is a very common cause, along with thyroid, for being fatigued. And then finally, growth hormone, which is often the one that's most overlooked. And in fact, in the course that we just reshot, again, I just filmed the hormonal section and reiterated growth hormone is one of the most common things that happens post concussion in terms of hypopituitarism. So any comments on that?
Yeah, I was tested for all those. So I forget exactly the results on the growth hormone, but I think, well, I'll tell you this. The neurologist asked me if I could be part of a group test for the impact of growth hormone on post-concussions post-concussion patients. So I think it wasn't in the normal level.
Meaning it was low.
Meaning it was low, yeah.
Yeah, so I'd be looking at that. So I'd be following that. So I think fatigue, brain fog, poor recovery, that's a growth hormone thing mainly. Testosterone, like I said, is more like libido and mood. So depression, particularly in men. Yeah, I would go down that. So I think if you've been on for 2 months, it's long enough. This goes for anyone trying bioidentical or hormone replacement therapy. If a woman has hot flashes and you give them estrogen progesterone, you don't get changes within a month, some dose is off or something's off. So I would go back and look at the growth hormone for sure. And I would, if you have to speak to your naturopathic doctor, I would also make sure that I'd do some additional testing on my adrenal system, which is saliva or urinary. not blood. Blood doesn't, in my experience, blood doesn't give us a good idea of the gray area, which is called subclinical, which is like, it's not the obvious, like super low, like growth hormones low, testosterone's low. Adrenals, you can have fatigue due to HPA axis dysfunction, which is the fancy way of saying adrenal dysfunction. But it won't get picked up on blood testing. You need that saliva testing. You need to see what's going on in the morning at multiple points. So waking, 2 hours after waking. And so I do with my patients, I do a full 5-point curve over 24 hours. And that tells you a much better appreciation for the adrenal function.
Okay. Yeah, I'll mention that to a naturopath. And I just wanted to ask one more thing in regards to, these new results. I've noticed, like, I was in a path because my autonomic nervous system was definitely compromised too, and so I was doing the exercise program Dr. Marshall has mentioned, and I was climbing up a little bit in my beats, like heart rate beat per minute, and I was at 125 for half an hour, and I was okay. And then, but I would hit a plateau. I would do it for like 3 days, and then by the fourth day, my legs were hurting. I just couldn't even get to that point really, and so I've been kind of stuck in that. And I was wondering, I thought, like, after I got these blood test results, that perhaps that this is the issue that is kind of impeding me to progress in that area. And I just wanted your thoughts on that.
So the thing that's slowing you down is almost like just muscle soreness from exercise?
Yeah, by the fourth day, like the hamstrings are just in pain, and energy levels. Like, I just don't have the
I wouldn't consider that to be a concussion symptom. I think that's more so just like your physical fitness levels and kind of like delayed onset muscle soreness that can happen when you're doing a lot of exercise. So you may want to just playing with doing exercise every second day. Just to avoid that part of it, right? Let your muscles recover. And there's nothing wrong with that either. And I think what you'll see is that you'll be able to kind of tolerate more and more just by allowing your muscles to recover. Your muscles need that recovery time sometimes. So in your case, because the symptom that you're experiencing isn't really like elevated concussion symptoms, but it's more like muscle fatigue and energy, reduction. So you may want to just start doing, let's do every second day and see how that works for you, just because that day off is probably going to allow things to recover and tissues to heal and that type of thing. And that might be a better way forward. The other question for you, just based on energy levels and fatigue, especially like, early morning, is have you ever done a sleep study or anything to look at the quality of your sleep? Like, do you track your sleep at all? I'm wondering if maybe you're not getting into deep sleep, or if there's some other sleep factor going on that's, not allowing you to clear inflammation and not allowing you to have good energy in the day.
Yeah, I've had a couple, and I'm just borderline. I think I forget the right words, but it was basically my breathing was stopped about 13 times per night.
That could be that's a huge factor for fatigue.
Okay.
Sleep apnea is common after concussion, even in people that are not generally sleep apnea sufferers. Like you think of sleep apnea as like, kind of overweight, that type of thing. But after concussion, even people with like normal body weight get sleep apnea. And sleep apnea is going to prevent you from getting into really good solid sleep. So have you been prescribed a CPAP at all?
So yeah, I felt kind of in between cracks where like my numbers were not high enough to require, like, I could get a machine. So I would have to get it on my own. It was like $2,000, which I'm kind of like, maybe I should just go for it. But this last test meeting that I had with the neurologist, she's going to prescribe a new sleeping test. So I think.
Yeah, that's good. Because ultimately, like, if you have sleep apnea, that's associated with all sorts of chronic health conditions, right? Like, it's associated with increased risk of cardiovascular disease. It's associated with increased risk of dementia and Alzheimer's and Parkinson's, all these different things. So you want to make sure that is like well controlled. And if you're waking up 13 times a night because your breathing is stopping, it doesn't allow you to get in that full, deep, restful sleep. And that could be the main source of your fatigue. You know what I mean? So we're going down all these paths with hormones and everything else, which obviously we should still look at. But I don't know, Paul, what do you think of this? Like,
I couldn't agree with you more. I think that it's like when you're looking at fatigue, you have to look at nutrient deficiencies, you have to look at hormonal issues, you have to look at sleep primarily, and sleep apnea, which a lot of people like, because honestly, CPAPs suck and nobody really wants to use them. Everyone's very kind of like hesitant. But I can tell you it's one of the most common things that when people actually do get that corrected, they're like, oh, it was a game changer. It's like, I feel like night and day. Because now your brain is getting oxygenated properly through half of your day almost, right? It's like you sleep for usually 8 hours or so. It's a huge factor. And so, I would say like we've identified a number of key issues. The growth hormone being one, the sleep, that's a really good astute pickup there, Cam, where, for anyone listening as well, if fatigue is not responding to other treatments, and to be honest, maybe it's like if the sleep apnea is happening, it's one of the reasons that you're not seeing the full benefits of hormonal therapy. Because again, it could be, you're low, we're missing maybe the growth hormone, maybe the adrenals, but then this is affecting everything because it doesn't matter how much testosterone you have. If you don't have oxygen in your brain for 8 hours, you're going to feel really sluggish and tired.
The other thing, just to like relay this to a study to show how important this is, there was a study done on former NFL football players, and they were looking at like CTE, right? Chronic neurodegenerative conditions. They did PET scans on them to actually look at tau. So tau is the protein that they find in these brains. It's the same thing that they find in Alzheimer's disease and other neurodegenerative disorders. There's about 20 different neurodegenerative diseases that basically result in tau protein accumulation in the brain. CTE is one of them. So they looked at these former NFL players and they did PET scans on them and they looked at the level of tau in their brain. Then they also did sleep studies on them. They found a direct correlation between sleep apnea and the number of tau proteins they found in their brain. Then half of the group with sleep apnea was given a CPAP machine, and then they rechecked them for tau after. And the tau levels actually decreased in their brain by getting on sleep therapy. So there's a whole bunch of like controversy around CTE that it's just related to concussions, it's a progressive neurodegenerative disease and you can't do anything about it, blah, blah, blah. But really, the way I look at it, and one of the theories and the one that I am really kind of latched onto, is that concussions may be the inciting event, but ultimately it's chronic neuroinflammation that is not addressed. And one of the main ways that we can clear inflammation in our brain is having proper sleep. Where we go to bed at the same time, we wake up at the same time, we optimize for sleep, we eat earlier in the day, we aren't eating right before bed to allow us to get into a good restful sleep. And if we have sleep apnea, that we control it. Because we can actually reduce some of these tau proteins and improve neural function by just allowing our brains to clear inflammation as we sleep. Yeah. So I think that anyone here that's concerned about CTE or even neurodegenerative, you have to look into like sleep and diet and exercise and all these things that kind of keep us young and healthy.
Yeah, we talked about the lymphatic system, and I've included that as part of the course in the 2.0, where this is the key area. This is the key time of the day during the night where you have this lymphatic elimination of tangled proteins, tau proteins. Basically, it's like your brain's detox system. And if you're not sleeping deeply, and this especially happens during the deep phases of sleep, which again happens kind of earlier to midnight, mid part of the night, you're gonna have more accumulation of this. So, anyways, I feel like you have some really key things to go on here, and we'd love to hear back from you if you want to share.
Yeah, absolutely. After I get the sleep test and I mention all these things, your recommendations to my naturopath, and yeah, I'll let you guys know how it all pans out. Thank you so much.
You're welcome.
Yeah, somebody's asking about like Oura rings. So for example, my Oura ring tells me my blood oxygen levels throughout the night, and it also picks up on breathing disturbances throughout the night. It's not going to be as accurate as a full-on sleep study, but it's going to give you an idea where if you have a lot of these breaks, then you should probably get a sleep study. So, I mean, Oura rings are somewhat expensive, but it is a good way to check like over multiple, nights over long term how things are going. But it also tells you what your deep sleep levels are and if you're getting good quality sleep, and it's pretty accurate in my experience.
Yeah.
But just relaying on this sleep thing, I had a terrible sleep last night. I went to bed later than I normally do, and I woke up at 4 a.m. and I couldn't get back to sleep because I was, anyway, there's a whole bunch of other things, but I was thinking about stuff and I couldn't get back to sleep. I am so foggy. My head feels like it's just got this huge pressure in it. And I just know that it's because my sleep, but like how many concussion patients are not, making that association and thinking, oh, there's just something wrong with me. I'm foggy, I'm fatigued and all this stuff, but they're just not getting really good sleep at night. So, it makes a huge difference.
With the few minutes that we have left, do we want to go over a little bit about the new program? I don't know if we want to kind of show the new recovery pyramid, because I do have that on my screen.
I pulled it up too.
Did
Maybe
you?
we'll
Okay.
just talk about like the genesis of it. So we met in, what was that, October?
Yeah.
October 4th, I think, is the date on
Yep.
our sheet. So we all got together, and we haven't redone this program since we first launched it. And obviously, as we've been going through this and having these live sessions, we're learning a lot and how things should be structured. And we're thinking, oh man, we should have had a section on this. We probably should add this, because some of these things just got put in as lives after the fact. But realizing how important some of these things are, we need them kind of in the main program. And then so we started basically by rebuilding the concussion recovery pyramid that we have, and kind of reordering things in terms of what should be done prior to, other factors. I can kind of let me share my screen and I can is it this? Yeah, it's this one here. So basically, like, step one is just understanding, right? It's the same general order. The second step then is working on mindset. Third step then we added in was like nervous system regulation. So that's a whole topic on its own, and this is going to be a combination of Paul and Melinda now. And then moving into inflammation, gut, brain axis, diet and hormones, and then finally into the rehab section. But then we've broke it down into like subtopics. So this is the like more of the complex pyramid. But so it's, the first part is really understanding what's driving persistent symptoms. That's like the number one thing to get to understand, because if you understand what you're going through, then it kind of demystifies everything and makes sure that you're able to follow the plan because you realize why you're doing it. And then it's developing recovery mindset. Then it's nervous system regulation and balancing the nervous system. Then we go into sleep, right? That's a whole topic, which we just kind of addressed. And then even within Dr. Paul's section, first we're going to address kind of hormones and neuroinflammation and that, or the HPA axis, sorry. And then diet, nutrients, supplements, balancing hormones. Then it's exercise. So even within the rehab pyramid, exercise. And one thing that I flipped is I did visual and vestibular in the first version before I did neck, and I've swapped those now. So now we cover neck first before visual and vestibular. And then other things that aren't even on here is that we have now a section that's on cognitive rehab. We have a section that's on returning back to work. We have, things on what to do in case of setbacks and, symptom increases and those types of things that are now part of that general program. So we've basically taken all of our learnings over the past few years, as well as all the updated research, and just overhauled the whole thing and structured it in a way that we think is going to be just a lot better. And we tried to make things more bite-sized. I know it's harder for me to be concise because I just like to talk, but I've done my best, and I know that we've done our best to try and make things a little bit more digestible, bite-sized, prescriptive in terms of, the information we provide. I don't know if you guys want to add anything to that or.
Yeah, I mean, I was just going to say that we've kind of listened to you guys over the last 5 years, and we've really taken into consideration all your questions and all your concerns and all the troubles that you were having, the feedback you were able to provide us. Right, the members that we have in the Concussion Fix program were such a big part of being able to redesign the program, because you've been able to help us out. What are the things you want to hear about? And we're also, as we're listening, we're hearing these commonalities, these common trends that are coming up over and over again. And we've been able to sort of take our first iteration of the program and build in all of these key things that we found were just repeating over and over again from our members. So really, big thank you to all of you and all of our listeners for giving us that feedback, because it's been able to help us tailor this new program to be really specific to PCS needs.
Yeah, I think this is the best program that I've ever created. I think this is a culmination of when we launched this program, it was based on our clinical experience. Now we've relaunched it based on practical experience with the thousands of people that have gone through the program. So we've definitely made it, in some sense, more digestible, but in other sense, more comprehensive. So the thing that has not been touched on is that if you are a member of this current program, you're going to continue with the access. You're going to continue to have access in this. And this might be a perfect chance for you to go back and actually rewatch a lot of the same things that if you were, we at the beginning of the question period, a lot of people, the summary was go back and redo the program if you still have some sort of symptoms that are present. So you're going to learn, I think, a heck of a lot more in this iteration.
Yeah. So somebody asked here about exercise, like why is exercise so late in the program? And you're right, because exercise should be one of the things that we start doing right away. But the problem is that if you have, other issues going on, you may not respond well to like challenging those exercise levels.
Mm-hmm.
So we encourage exercise in the first module, but it's basically just start with daily exercise in terms of like walking, not necessarily starting to challenge your heart rate thresholds or anything like that. We want to try and build up, like even clinically, the first thing we do is we do education to try and like teach people about what it is. And then we give them the diet plan, and then we start giving them sleep and stuff like that. And then we don't do exercise for the first couple of weeks, and then we start implementing it. This is with PCS. When I have an acute patient, I'm basically doing exercise right away because I can prevent a lot of this stuff if I start doing exercise right away. But once PCS is sat in, there's now a little bit more baggage that we have to unravel before we start doing like pushing you into symptom thresholds. So that's why it comes later. But we do still want you to start exercise early, but just you're not trying to like go out and go for runs or see what your heart rate thresholds are or anything like that. Just go on nice light walks, because then you get outside, you get the breathing, you get the blood flow, you get the the benefits of it without necessarily challenging your system to like a breaking point, which you're going to do later in the program.
Yeah, I think you just brought up a really good point, Cam, is that this program is designed for PCS. So you've been suffering from persistent symptoms for quite some time. When we're thinking about exercise right after concussion, that's acute concussion rehab. So this is not sort of what this program is focused on.
Well, I think you can apply a lot of it to acute concussions. The reality is that you kind of want to do all of it at the same time, but that's difficult to do. So like you want to move your body, you want to have a mindset that allows you for recovery, you want to start eating clean, and there's a difference in the way you want to treat an acute concussion, like you said, Melinda. And the reality is the majority of our members are more persistent symptoms. Like again, because 70% or so of concussions go on to just resolve after a week or two. Most people don't start really seeking out care like this program until after a month, where they realize that their symptoms are not getting better. So in that case, we have to look at, do you have any sort of mental health limitations? Like if you have anxiety, trying to ask people to exercise right away is going to be a challenge, because you're wondering, oh my gosh, my symptoms are getting worse. Like we're setting the tone and building on top of each other. But in a perfect world, we would try to do everything at the same time. But most people with PCS, that's outside their ability and bandwidth. And so we've kind of chunked it out this way. But yeah, moving your body is absolutely fundamental and foundational.
Yeah, I think maybe that's one of the misconceptions is we're not asking you to stop what you're doing in certain ways. We're helping you to tailor what your recovery program will look like for you. So if you're already walking, it doesn't mean you have to stop walking in order to go through the mindset and the nervous system regulation modules. It just means, adding these things in as you're continuing to do things that are supporting you. Maybe that needed a bit of
Yeah,
clarity.
and some people might come in already being able to exercise fully, like they've been going to the gym, and it doesn't cause their symptoms to increase. Yeah, keep doing that, of course. Like, don't stop doing that. But it's if you haven't been exercising, it's not like when you first come in, it's like, okay, there's other things we want to make sure we address first before we have you start challenging those levels. But we still want you to start walking right away, and that's made clear in the program too.
And a lot of people come in feeling super overwhelmed already of what do I do? And so if we were to just say, do all this at one moment, like
Yeah.
that overwhelm is just going to get worse. And most people will just be like, "Wah," scared
Yeah.
and just not do anything. And so that's why we say, like, take your time, because we don't want members to do, here's 5 new strategies you need to do this week. No, one
Yeah.
thing at a time. Learn this, implement this one strategy. Once you're comfortable with this, then move forward, because that overwhelm is what we're avoiding.
Yeah. I find a lot of people like would come into the program and just like consume content, right? So they'll be at the end of the program and they've only been here for a month. And you're like, "Whoa, that's like way too quick." There's just no way that you can implement all these strategies, in that way. So that's why we always try to say start with the first part, implement those strategies so they become like your routine. Like you don't even have to think about it. You're just doing this. That's part of your everyday. It's like you just do this without even having to write it down or remember to do it. It's just part of your everyday. Then once you have that routine, now you're just adding in one more piece to your already existing routine. Because ultimately, like Dr. Paul said, you want to be doing everything, but you can't go through everything and then try to implement all at once because it just won't work. You'll just be like, I don't even know, it's too much. But if you start and just say, okay, I'm going to implement these 2 things, and you do those 2 things every day, after like a few weeks, now it's become habit, and you just do those. And now you're just adding in one more piece to that. So now now it just includes one more additional thing, and then it's just one more additional thing. And then before you know it, you have a really digestible, optimized recovery routine where you're addressing everything all at once, right? A lot of other people make the mistake of like, oh, I did that and then I stopped doing that when I went to the next thing. That's not how it works. Everything together is what works, but you can't just come in and try to do everything all at once. You have to really phase it in to really build that routine as part of your just everyday. This is what I do, right? This is how I eat. This is what I do for my sleep. This is what I do for exercise. And I'm going to do it this time and this time and this time. And it all just goes through in a very, very fluid way.
I see a question about the nervous system. I just lost the question, but I think it said,
what kind of changes have you made to
right.
the nervous system part of the course?
Yeah, so the nervous system, talking about nervous system dysregulation was embedded in the mindfulness module in the first recording. Now it's separated out into its own module. Of course, over the last 5 years, there's also been a huge rise in understanding the nervous system. So we've got a lot more information and research that we can use to help support people who might be experiencing nervous system dysregulation. So it's its own section now instead of being embedded within the mindfulness framework. So there's lots of information there.
Right. And so we are hoping that this launches early summer, so within the next few weeks. Just finishing off a few last minute things, and we need to actually upload everything so that it's in order in the program and everything. So a little bit more patience, and this 2.0 will be going live. And as someone who went through the program shortly after you guys had launched originally, to seeing where we're at now today, I'm already like, there's so much more to the program today than there was when I went through it as a member. So I'm always like, this is like the app, the lives, like I didn't have any of that. So I'm like, you can absolutely recover without it, but it's so much more of a robust program. And now this 2.0 is just going to like jump even further, that I'm excited to see it all. and get to know where everything is in the new one. I have to watch it again so I can then answer questions better for people being like, okay, where's this at now?
Yeah.
So a little patience on me. I might not be quite as quick of answering where things are in what lessons until I go through it myself too. So that's a great spot to wrap up this week. So thank you for everyone coming on, asking questions, and a little preview of Concussion Fix 2.0. Have a fantastic day, everyone. Bye.
Bye-bye.
See you, guys.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit. And don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.